But I will tell you that we're doing this right now on a daily basis, and our priority is to make sure that just because one person in a classroom is positive does not mean that everybody goes home. We're making sure that when we do our contact tracing with the help of the school board as well as with our staff, that we have dedicated specifically teams for the school, that we can turn around as quickly as possible. If we get notification of a child being out and needing to be quarantined, we immediately start that contact tracing to find out who that child was around, what type of setting it was, do they go from class to class, do they not? So all those decisions come into place, and the idea is to get all the vaccinated kids either not have to leave the school that day or be able to come back the very next day. So far, we've been able to accomplish that. We're continuing to hire more people because if these numbers continue to go up, which we expect they will, we will need even more contact tracers than what we have now. We have 65 on the pipeline right now to come in. So the idea is we've been working really, really well with the school district. They have put into place not only the Department of Education protocol, but they've tweaked it a little bit to make it as clear as possible. Many of the parents who have vaccinated children are making available their vaccine cards so that the school has that record on site, so that child would not have to go home. And of course, we also are working very closely with the principals to make sure that they understand all the changes that have occurred and that they can communicate that well to the parents. You know, people become very anxious when they find out that one child in their classroom is positive, and so we try to talk to those parents. Our Epi line is dedicated to the public who is calling in as well as to the school board, and we have it set up that each school has a specific person to contact for that information. Also, the tremendous help that has been done by the school nurses. We now have an actual school nurse in every school, and their testing that they're doing is very, very valuable so that we can eliminate folks that, you know, are not COVID and just have the sniffles and the, you know, that's a daily routine for any teacher in a classroom to have sniffly kids running around, but now it's more important than ever. So we're really concentrating. There's been a lot of rumors. When school started, we already had a whole group of kids that had been positive over the summer and close to school. So that got confused. We did not have 400 people out in one day. That was not true. It was the accumulation of everybody that we were handling at the time. So so far it's working really well, but I will tell you that the thought of these number of cases continuing to go up and the spread in the school is something that we're trying to control very, very closely by really dedicating time and effort to making sure that we can do all the screening and all the medical information as quickly as possible.